everybody, Kevin Flynn here, 15 years in the network security business, and I've got one of the great jobs, I think, in the world, because there's always going to be bad guys, and there's always going to be new technologies that the bad guys are going to use. So most of what I'll be talking about tomorrow, what we're showing at the booth 109, is the issue of how the threats have changed. What you have out there is a constantly evolving threat landscape, and most of what you have installed now is not going to work. I'm not going to get into speeds and feeds, and my presentation doesn't even have any slides about the boxes that we make. What we do want to talk about and educate everybody is as you look at mobility issues, as you look at communications with your patients, with your pay cycles, how are you going to deal with the kinds of things that will happen, either people doing something maliciously toward you for lots of different reasons, or because of the stupid things that innocent people will do. And so the main message I have to give is that the threat landscape has changed. Application layer threats, blended threats, there's a whole bunch of stuff. I could spend the next 20 minutes scaring the pants off of everybody, but just open up the New York Times, just Google botnet creation, and you'll see how easy it is to do bad stuff. So I think I've got maybe 30 seconds left up. I am going to go. Okay. So again, 109 is the booth. I want to talk about, we'll have some really smart folks there who've been in the healthcare business for a long time. But again, the notion is that what you probably have today probably isn't going to work for what you want to do tomorrow. And as you look at network security, don't think of it as something that you sort of have to have, sort of a pain in the neck like buying car insurance. I didn't say health insurance. But look at it as something that, think of it as what you could do if you could do it securely. How do you let doctors bring in their iPads? How do you have Twitter feeds to patients? How do you create Facebook pages that your employees, that the doctors, that all the different constituencies can have, and how you can do that securely? Because the doctors will expect it, the nurses will expect it, the patients will expect it, society will expect it. And you're going to have to deal with it. And look at the security issue as an enabler to new technologies, not as a constraint. And I found that as companies have done that, they started to open things up. And the people that are on the forefront of things, they're able to deal with the threats and then expand what they're doing with IT within the constraints of what can be done and what has to be done with the threat landscape, with the regulatory environment, with HIPAA, with PCI complaints, et cetera, et cetera. And I've just gotten the 15-second mark from Bob, so I'm kicking this off. I'll be here. I've got some great colleagues from Fortinet that'll be here, and I look forward to further discussion.
Hi everyone, I'm Bernice with Cyber-Ark Software, a leading provider of privilege identity management and government file transfer solutions. With our enterprise password vault, we enable organizations to gain control of privileged identities by providing individual accountability to shared administrative access. For example, the next time you have one of your IT admins logging into a firewall and placing a firewall rule on the wrong side of an interface, thereby blowing a giant hole into your network, you'll have individual accountability by utilizing this tool. We also enable organizations to gain control of privileged identities by enforcing your security policies for frequent password changes. So we can regularly and automatically change your passwords, whether it's hundreds or hundreds of thousands. And additionally, we have secure file transfer solution based on our secure document vault, whereby you can securely transfer highly sensitive information, regardless of document size or location.
Hello everybody. I'm here today to talk to you about a couple of dirty little words that are sneaking into the mobility security space. And they are consumerism, BYOD, or bring your own device, or BYOT, bring your own toys. So as CIOs, I'm sure you're being challenged with a couple of key things. The first one is, how do I support all these different devices, especially if they're personal devices? What happens if I'm challenged to figure out how to extend access to vital information and applications virtually anywhere throughout the organization at any time? What if I'm looking to save 9 to 40% of my telecommunication costs? And finally, what do I do if I want to make sure I have the security of a BlackBerry for all of these devices, either Apple or Android devices, that are trying to come onto my network? Well, quite simply, you need to come talk to Good Technologies. At Good, we secure both the file, the application, and the data level of information. So we secure information on mobile devices, non-BlackBerry mobile devices, anytime, anywhere, through a very simple software program. In addition, we've been doing this for 11 years. We've been securing applications, in fact, a communication and collaboration application. And now we've built a platform that provides both the tools and the services to secure any mobile application.
Wi-Fi can be very touchy, as we all know, but also Wi-Fi can be very important to make a lot of networking technologies available to us. I got another question for you guys. What are some of the hot topics in healthcare right now? If you get any newsletters, why are you here? Somebody just kind of yell out some hot topics right now. HIE, for instance. What else is big to you guys? Anybody? What's that again? ACO. What else is a big thing? Mobile mobility. Meaningful use is really big on a lot of people's lists, right? And electronic health records are the two big things I was driving for, hopefully. So if you had electronic health records and meaningful use, who would trust the hotel's Wi-Fi for that to work? Nobody, right? Wi-Fi here is really bad. Not to knock on the hotel people. Is anybody here? I'm sorry. But Wi-Fi has to work in healthcare because you need reliability and you need high performance for those two things to work really well, especially as you're rolling out new technologies like nurse call stations, electronic health records, things like that, where you need the network to not only be reliable, but also widely available, right? The two things with those technologies are you want it to work, obviously, but also you need it to be easily adoptable. If you tell a doctor or a clinician or a nurse that she has to go back to her office every time to enter data or has to be in a hallway at a specific area for that to work, she's not going to use it, or he's not going to go back and do that. So having Wi-Fi that is ubiquitous across your entire network, that is high reliable and also high performing is a key criteria. And that's what Xirrus prides itself on, is the ability to deliver high performance Wi-Fi in mission critical applications to give you health grade Wi-Fi that you can use anywhere in your hospital or facilities that work and are reliable whenever you need it. It gives you the always on wired live performance for all the new technologies that are coming in to the healthcare facilities like iPads, wireless devices, things like that.
El-Dorado, which is our company, is a division of Emphasis, which is owned by Hewlett-Packard, so we are an HP company. El-Dorado has been in business for 30 years, delivering health benefits management solutions to the payer community, and we intend to continue to do so long into the future. We have two principal products. The first is our legacy product called HealthPack, which services 75 customers, 34 of them licensed, 41 of them on our ASP. But our second product is our flagship product that we'll be focusing on here today, which is Javelina. Javelina we announced in 2009, spent 2010 implementing our first customers, and in 2011 we brought our first 3 live, with 2 more expected in the next 4 or 5 months. We have a total of 7 customers with 3 more in contract for Javelina. Now, Javelina is a modern, scalable architecture that's web-enabled and browser-based that delivers very low cost to the user.
We have been in the enterprise business intelligence and data integration business for 36 years, so we're even older. And we're an independent software company headquartered in New York City, and we've been cross-industry, but now we have a particular focus on healthcare. And our basic strategy, we have a strategy and a framework for enabling you to move from fragmented care to integrated care. And the reason we can help you do that is because we can span all of the data sources, connect all the systems together, and deliver information at the point of service. It could be real-time information, it could be regulatory reporting, performance management, analytic applications, etc. A wide range for health information exchange. So just talking briefly about some of our products. First, the markets we address. We have lots of clients that are integrated delivery networks, lots of clients that are academic medical centers, places like NYU and Dartmouth and Stanford, etc. integrated delivery networks like Kaiser and Lehigh Valley, etc., the VA health system. Actually, we're helping them. I don't know if you knew this, but they were the first electronic medical record, and they had a strange problem. They were very advanced in terms of the functionality, but they have 130 disparate versions of Vista. So they put it out there into their regions as open source so that it could be enhanced and improved. And we actually help if a veteran gets sick in Long Beach, California, but he's from Boston. Now with the federated approach that we provide them, they can look up that health record across instances of Vista. So we take these really tough integration challenges. So from a product perspective, we have two core technologies: Web Focus, which is our business intelligence technology; iWay Software, which is our branding for our data integration. And the way we bring that to healthcare in terms of solutions, from a Web Focus perspective, we have two categories of solutions. Some are performance management solutions. Our performance management framework is #1 rated by Ventana Research that focuses on that. We deliver out of the box over 400 standard healthcare metrics, including all of the ARC measures, core measures, PQRIs, etc., meaningful use, as well as financial and operational. With Web Focus, we deliver analytic applications that support finance, support clinical operations, support the emergency department, etc., etc. So across all of these things. So I'm going to finish with 3 things that I'd like you to remember. We're rated best in class by Class Research of the enterprise players. We're rated highly by Gartner and many of the other analysts. The thing that is recognized is the fact that we're independent. We offer the most flexible. And thank you very much.
I'm Mike Doyle, I'm the chairman of Medsphere. What we've done is we've actually taken the Vista product from the VA and created an open source version of it called Open Vista. As you heard earlier, Vista is the most widely deployed electronic health record in the world. The VA invented many interesting things, including BCMA. And we've taken a technology that we have, as taxpayers, have spent $8.5 billion creating, and we made it available to every hospital in the United States for free. How do we make money? We're a service company. So we support, implement, maintain, and actually built an ecosystem around the application that allows best practices to be shared. We have many of our hospitals that are building new modules onto it because we built a framework that allows modular plugins. There are entrepreneurs starting companies, building applications on top of it. It's available in the cloud, or it's available behind your firewall. It costs about a 20th of Epic, probably a quarter of McKesson, an eighth of Eclipsys. So it's a very affordable solution. The typical community hospital will pay all in for everything about $3.5 million for our application. It's been deployed to 192 hospitals, 2,000 clinics. Our largest customer is Indian Health Service, where we're deployed to 311 clinics and 56 hospitals. We have the whole state of West Virginia up and operating on Open Vista. The taxpayers of West Virginia have saved millions and millions of dollars. What's really exciting is the VA is going open source. And Medsphere is one of 14 companies that have been selected to actually share in the $12 billion that will be invested in Vista as derivatives over the next 10 years. So what that means is if you look at the R&D budgets of all of our competitors, some of which I've mentioned, and you multiply it by 4, it will not equate to the amount of money that's going to be spent on open source Vista. Meaningful use came out of the VA. So our hospitals almost immediately can attest, once they actually deploy our solution, a 467-bed hospital called Lutheran Medical Center in Brooklyn, New York. I went live 5 months ago. Hi. I knew there was a Lutheran here. They're at 98% CPOE today. They have completed their attestation, although they haven't applied yet because New York is kind of a quirky place. But the first 4 hospitals that have gone through attestation have all got it in spades three times. For example, you have to be at 30% CPOE. All of them are at 90 plus. So it works. 65% of doctors over the last 20 years have trained the VA. The training program at the VA is 1 hour, and you're at CPOE. So it's a very intuitive system. It's very easy to use. Physicians really enjoy, believe it or not, enjoy using it because it makes their life easier. Nurses can go back to being nurses and not be scribes or handling paper for physicians. I've had nurses literally come up to me and hug me once they found out who I was. They said, "You've allowed me to go back to what I was doing 25 years ago, which was caring for patients." So thank you very much. There's promotional material about our company. I really appreciate it. Thank you.